Hello, my name is Nive and I lead community partnership for GroundGame.Health. Thank you for joining our webinar series to learn more about how community-based organizations are connecting with people at ground level to meet health equity needs. For this first conversation, we are grateful to welcome Ashley Reynolds of Aging and In-Home Services or AIHS, an area agency or aging based in Northeast Indiana. Their mission is to promote dignity, independence, and advocacy for community members, people with disabilities, and family caregivers. Ground Game Health is proud to partner with them to deliver much needed services to community members. Today, we're going to focus on food insecurity. Food insecurity affects 5.5 million community members and costs the US healthcare system an additional 53 billion annually by triggering chronic disease and causing emergency room visit, hospitalization, and readmissions. But first, let's meet Ashley. Ashley, can you please give us an overview of AIH's mission to your role?
Yes, of course. So AIHS is a local area agency on aging, or AAA. We work with other community-based organizations to provide clients with the ability to stay safely within their home and to live independently and comfortably from the comfort of their home. A little bit about me. I am a supervisor for the population health department with aging and in-home services. I'm going on 6 years. I started as a care coordinator, so doing exactly what we're going to talk about here, doing initial assessments with members and identifying their needs.
Ashley, you wanted to focus on food insecurity today. What's the relationship between food insecurity and health?
Yeah, absolutely. Food insecurity is one of the most common issues that comes up when completing our initial assessments with members. Um, a little background about completing assessments. So we are given a set amount of number of monthly referrals from different organizations or from insurance companies every month. So our care coordinators will call out to these members, engage them to complete an assessment, identifying the risk factors that they may have, needs that they may have, and food is often one of the very first needs that is identified. Um, Groceries are incredibly expensive now, as we all are aware of, especially when impacted by other SDOH factors, like a lack of transportation, a lack of employment, lack of family support systems. In some places, grocery costs have increased from 10 to 15% in recent years. And food is just one of our basic human needs for survival, just like food, like just like shelter. If you don't have that, how are you going to get through your other daily tasks for living? And I describe it as sort of like a waterfall effect. If you don't have something, everything else is going to get wet, right? There's one thing missing, everything else is going to be affected.
Yeah. So, our role at Ground Game is to connect the unconnected. And one of the ways we do that is to make it easier for health plans to work with CBOs like AIHS. Health plans want to help close gaps in care, and we have the resources to support CBOs. But it's very hard for them to work directly with CBOs because our health plan is structured very differently from local nonprofit. So, my question is, what do you wish health plans knew about food insecurity? What are some of the gaps that they may be missing?
Yeah, absolutely. I think the problem that some insurances or some organizations might not think about is it's not just when we say there's a food need, it's not just a food need. Um, for example, where I live in a town called Muncie, Indiana, and where I live, it's near the college, so there is access to grocery stores, but there are many rural areas in our whole county, humongous areas without any access to grocery stores. So we would call that a food desert. A large population of our county has little to no access to food to grocery stores. So, for example, might be farmland, Indiana, very rural farming community, that perhaps only has one convenience store or a gas station that's either walkable or close by car. So that might be the only thing that's close to a grocery store that has some kind of food available. So even if a member has access to food pantry, or SNAP, even if it is accepted at a grocery store, a convenience store, there's likely no fresh veggies or fresh fruit. There might be only a can of SpaghettiOs that might cost $4. So addressing food security insecurity calls for much more than just financial assistance. There's other factors that cause food insecurity, including availability of the food in the stores in the first place, as well as their ability to get there with transportation. So speaking of transportation, we're always looking for food pantries that deliver. This becomes especially relevant for during COVID, but it's relevant all the time for multiple reasons. And some are that the elderly or disabled are unable to drive, to use public transportation. Mental health can make it difficult to leave the home. Childcare can also make this difficult to come by. But that is what is needed most, particularly for elderly and the disabled population. Mental health also is a factor, childcare, and access to a vehicle. Food pantry that also provides pet supplies is something that I find that would be beneficial, because if you're having issues accessing groceries for your family, that includes your furry family members. So a question for you: what suggestions does Ground Game Health have to try to solve some of these issues?
That's a great question. And to be honest, we draw a lot of inspiration from organization like you. Also, Ashley, actually, I had privilege of visiting your facility at Indiana, and I did take a tour of your food pantry. There's a really no substitute for community care workers who are giving personalized attention to members and their social determinants of health. We always step back and think, how can we make it easier for community care workers and CBOs to do their job? One of those key solutions is making it easier to do this assessment in first place with an easy to use platform that enables more efficient documentation and automations for claims and contracts. You and your colleague shouldn't be burying your heads in system or contracting. You want to be focused on working directly with people. So that's where the right technology plugs in. We also believe that health plans have a huge role to play here. They want to drive better health for members and close gaps in care, but it's difficult to get their data and resources to CBOs without someone playing a connecting role. That's why we are so focused on our message of connecting the unconnected. Good healthcare and community service are always local. So we think a connector like us can solve the problem getting health plan resources to local CBOs who can make real difference. Food insecurity is a great example of this. AIH is delivering meals to people's homes and providing vouchers to restaurants and farmers markets. You can do that because you know which farmers markets are convenient for people, which restaurants are accessible and appealing to members.
Absolutely. And things are always changing on the local level, and it helps to be in the loop about these local services that are available. So, for example, we work with a lot of churches that are local to our members, some of which have started offering drive through pantries. Just another local example for me is a food pantry at my daughter's school. It's located in the school building and it's very helpful, especially in terms of providing fresh fruits and veggies that can sometimes be difficult to come by for families. Our school pantry in particular also provides personal care supplies like toiletries, which is very helpful because SNAP and other benefits programs exclude those items. Um, Food insecurity, therefore, is just one piece. Overall financial assistance is incredibly important, as is medication access. And of course, a lack of access to medications is one of those key things that drives up utilization. So we're always looking for ways to get people the medicine that they need to stay healthy. So, for example, I'm always referring my clients to Cost Plus Drugs, which has affordable prices for medications, whether or not you have insurance. All you need is a referral for that medication. I tell everyone about this website, whether they're clients or not, including my own family members. And they also deliver medications directly to your home, which again is very important for access.
Yeah, and it means so much when someone gets personal advice. Learning about where to buy your medication from person in your community that you trust versus always relying on a platform or an app tell you what to do. Now, shifting gears a little, something we do every morning at Ground Game Health is share the stories of real people that are impacted by our work. What are some of the stories that you have stuck in you lately?
Yeah, well, personally, when I was still doing the care coordination before I became a supervisor, I had a member who was living in Baltimore. She was a caregiver at a local nursing facility. She herself had type 2 diabetes. She couldn't afford her insulin. She was actually from Jamaica, so she did not qualify for food stamps. So she was struggling financially and with access to her own medications. I looked into local grants and I was able to locate one that happened to be just for members or patients who had the diabetes diagnosis. She was chosen and approved for that grant, and we were able to give her almost $8,000. After that, she was able to afford groceries, her rent, and also life sustaining insulin. One of my staff members recently had a member in her 80s without access to transportation who was solely living off of bread and coffee. She found My staff member found a food pantry that was able to deliver to this member every month. So not only have we identified a need and solved it for the time being, we're also providing a service that will be able to help them in the future going forward. So that feels really good.
Yeah, it's such an important point. The work you do doesn't only help people get healthier, but it also prevent health challenges from ever occurring in the first place. So, would you need to keep doing this good work? What are the resources that enable AIHs to continue providing these services?
Of course. Well, funding is at the top of that list. In particular, we need to find substantial funding. Working with Ground Game Health is so helpful because you provide study resources that allow us to focus more on our work and less on finding funding all the time. Funding is related to adequate staffing, the ability to take good care of your staff so they can do work for the long term, and all of those things are critical.
Yeah, we know how thin CBOs are stretched and how financial sustainability is key to unlocking all of the amazing value you provide in communities. At Ground Game Health, we have facilitated the flow of 19 million from managed care organization to CBOs because you are the best position to make this impact, address health equity issues head on, and build healthier communities. Thank you for sharing your insight today, and thank you everyone for listening to this important conversation.